So today we're going to be talking about joint preservation, and more specifically, preservation of the articular cartilage of the joint. Now remember, the definition of arthritis is the thinning or the loss of that articular cartilage. And osteoarthritis which is the most common type of arthritis, is global or generalized loss of that articular cartilage. Cartilage loss can also be more focal or localized, and this can be following an injury or in the setting of malalignment where a particular area of the joint is overloaded. And the treatment options for these more local cartilage lesions do differ from generalized osteoarthritis. It's important to understand that the discussion today in this video is a more generalized discussion about joint preservation options. But these options really have to be individualized to each specific patient. There are several treatment options for these more focal cartilage lesions with the goal to preserve the joint and the ultimate goal of delaying or avoiding altogether the need for joint replacement. In patients with joint pain who present to my clinic, the first step is typically to get an X-ray. Now, if you remember from the previous video, osteoarthritis typically presents on X-ray with joint space narrowing or narrowing of the space between the bones, or bone spurs. Now, these findings typically are not as common in the more focal or localized cartilage injuries, and therefore oftentimes the next step is obtaining an MRI, which helps us further analyze the cartilage and the other structures about the joint. Additionally, I like to obtain alignment films of the limb or of the joint to assess for any malalignment, whether that's angulation or rotation or translation of the joint, which can alter the biomechanics of the joint and overload certain areas of that joint. For patients with more focal cartilage injuries, there are various treatment options with the goal of preserving the joint and, again, the ultimate goal of either delaying or avoiding joint replacement altogether. These treatment options really have to be individualized to each patient, and they're based on various factors like the patient's activity level, their age, the size and the location of the lesion. For patients that have tried medications and are not finding significant relief, then we have the discussion of the surgical options. The first option to consider is correcting any malalignment, whether it's rotation or translation or angulation. And we do that by various osteotomies, where we can cut the bone in certain ways to change the angulation or change the rotation, or translate the bone in certain ways to alter the mechanics to unload those areas that have been overloaded. There are surgical options of cartilage regrowth with a procedure called a microfracture. So this happens when we create little small holes in the bone to allow for blood flow and bone marrow to extravasate into that defect and regrow cartilage. Unfortunately, the cartilage that regrows here is called fibrocartilage or scar cartilage, and it is not as durable as the native cartilage. There has been some advancement in the lab using medications along with the microfracture that can help eliminate the fibrocartilage and encourage growth of the native cartilage. There is also cartilage transplantation procedures. Yes, transplant of cartilage, whether it's from your own body or from donated tissue like a cadaver. There is also a cartilage transplantation procedure that involves growing your own cartilage in the lab and then transplanting a sheet of your own grown cartilage onto the defect. This does require two procedures, the first to obtain a biopsy of the cartilage, and then a second to implant that grown cartilage. And of course, some of these treatment options can be combined with each other, and again, it depends on the patient and depends on the cartilage lesion itself. Joint preservation is really indicated for patients with symptoms related to their cartilage defect. It is not for asymptomatic patients for the sole purpose of prevention. It is for patients with active symptoms or early symptoms associated with their cartilage lesion. Joint preservation is helpful for patients who have exhausted all other conservative options. And the indication for surgery is not based solely on X-ray or MRI. It's really about the patient's symptoms and acceptable function. It's really important to come in and talk with me, talk with your surgeon about the different treatment options for your cartilage lesion, and really come up with a plan and appropriate expectations of what that plan may look like.